Hi everybody, it's Ezekiel. Today I want to talk about the link between being born via cesarean section and childhood obesity, and obesity even into adulthood as well. Now I will talk about the link between um between cesarean section and obesity later on in the video, but first I want to talk about just a quick history of cesarean section. So the first cases of cesarean section that were found in the historical record were from as far back as 700 BC. Now, back at this point, any time a cesarean section was performed on a woman, the death rate was 100%. The woman always died. Now, fast forward to the end of the 19th century. At this point, anesthesia was invented. So surgeries like cesarean sections were able to be performed without causing the patient immense amount of pain. Now, cesarean sections back then, the death rate was still quite high, even as high as 80%. Um, Infections were extremely common, and they were also um, cesarean section was quite uncommon back then, like less than 1% of pregnancies. Then skip forward into the 1930s. This is when antibiotics were invented. Now, antibiotics changed medicine completely. Um, Now cesarean sections were able to be performed um, with a much, much, much reduced risk of infection. So cesarean sections were able to be performed very successfully, and the death rate was just collapsed from about 80% down to like less than 1% within like a few decades. So like a miracle basically. Now since then, since the 1940s up to now, cesarean sections have increased enormously. Particularly in high income countries and in middle income countries. Not so much with low income countries. So, for example, in the US, cesarean sections in the 1940s, about 1%. In the 1960s, about 2%. Then in the 1970s, you do start to see a big increase, goes up to about 5.5%. In the 80s, up to around 15%. In the 90s, up to about 23%. And then now, the cesarean section rate in the US is about 32%, which is very similar to what it is in the UK today, which is about 31%. There are countries in the world that have very high cesarean section rates, such as Brazil, Korea, Dominican Republic, um, Egypt, Cyprus. These places have cesarean section rates of around 55%, which is extremely high. Also in Brazil, there's an interesting difference between cesarean sections in, whether you're born in a public hospital or a private hospital. Private hospitals in Brazil, private maternity hospitals, about 80 to 90% born via cesarean section, whereas in public it's 30 to 40%. So huge discrepancy there. Now in low income countries such as like sub-Saharan Africa, it's about it's less than 5%. So extremely low in those countries. So why has the cesarean section rate increased so much? Like why has it increased so much? And specifically, why has it increased so much since the 1970s? Um, why did it increase so dramatically after the 1970s? Now, the biggest reason for it, I would argue, is the increase in the number of women who are overweight and are obese. Um, that I would argue is the biggest reason for this big increase in the rate of cesarean sections. Um, Now, if you look at graphs of the obesity rate in, let's say, the US, the UK, Europe, other developed countries, one thing that you will realize is that typically it you they start collecting data maybe in the late 1960s, early 1970s, and then you just see the graph just basically just continually increase since the 1970s. So why is it that being overweight during pregnancy is a risk factor um, for cesarean section? Okay, so the main reason is that during pregnancy, women obviously gain weight during pregnancy. And the more weight a woman gains during pregnancy, then just the greater stress that that places on her body. Now, pregnancy just in and of itself is going to place a huge stress on a woman's body. So it's somewhat similar to someone that is overweight. That extra weight puts a lot of extra strain on the body. So they're like more at risk of, let's say, high blood pressure, or diabetes. Now, for women during pregnancy, it's somewhat similar. So, it's recommended for a normal BMI woman to gain between 11 to 16 kilograms throughout her pregnancy. So that's a significant amount of weight to gain, uh, which is going to put strain on the body. In addition to carrying a baby, um, an overweight woman recommendation is generally between 7.5 kilos to 11 kilos to gain, so less than the normal BMI woman. And then an obese woman, so BMI of 30 or more, is recommended to gain between 5 to 9 kilograms. So uh, even less than the overweight woman, and even more or less than the normal BMI woman. Now, I don't really think it's possible to only gain 5 kilos during a pregnancy. I don't really even think that that's possible. Um, but anyway, now typically what happens, in reality, what happens is very often overweight women actually end up gaining even more weight than the recommended weight gain of a normal BMI woman, and that's very often the same with obese women as well. And so all that extra weight gained during pregnancy, in addition to carrying around a baby, understandably puts the body under a huge amount of pressure. So women, at least in developed countries, they are screened for things like preeclampsia, which is just high maternal blood pressure. Then very often they're screened for gestational diabetes. They're screened for obstructive sleep apnea, which is like where you basically stop breathing in your sleep for short periods of time. So all of these things can just make labor uh, difficult. It can make it very difficult. Trying to push out a baby while carrying all that extra weight is extremely difficult for a woman. So that's why cesarean section is very often needed in these cases. So other kind of complications that overweight women have during labor are something called fetal macrosomia. So basically, all that is just a baby that's quite heavy, heavier than what you'd expect a baby to be. Now, obviously, trying to push out a baby that's very heavy um, is obviously going to be more difficult. Cesarean section is going to be more likely in cases like that. Now, overweight women are more likely to have basically overweight babies. They're also more likely to have underweight babies as well. Um, Another thing is what's called dystocia. Dystocia is basically just a very kind of difficult labor, a very slow labor, specifically a very slow labor, where just it just seems to be going on for a very long time, and like very little progress is being made. And so very often in cases like that, the obstetrician will just make a decision to do a cesarean section. Yeah. Now there are some reasons related to the increase in cesarean section rates that are not related to the increase in maternal overweight and obesity. Um, so some of these reasons are just being born in a private hospital, like we've seen just there is the case in Brazil, where cesarean section rates are much higher in private hospitals than in public hospitals. Now, the reason for this is that the doctors just get more money for performing surgeries, so they're more likely to push the patient in that direction. Another big reason is just fear of litigation from the doctor. Now, this is somewhat related to maternal overweight and obesity because those kinds of women will have higher risks for complications during pregnancy, and thus, they would be more likely to sue a doctor if something went wrong. But also, the doctor's just generally afraid of any sort of litigation at all. So, one good example of that is just like the abnormal presentation of a baby. So, that's just when a baby isn't head first facing towards the birth canal, it's facing sideways, or its feet is facing the birth canal. Sometimes doctors, now very often in abnormal presentation, I think even as high as 80% of the time, the baby will eventually turn around and face the correct way, which is head facing the birth canal. But that can be a reason for an obstetrician doctor recommending a cesarean section, because they're just afraid that the baby mightn't turn around and they leave it too long, and then there's a big problem, maybe even who knows, like the mother could die or something, and then the doctor ends up getting sued. So just to remove the risk completely, just to perform a cesarean section. Another problem is in middle income countries, so this is be kind of probably applies to the likes of Egypt, probably Brazil as well, is Dominican Republic probably as well. With the high cesarean section rates, is that very often the obstetrics kind of department, the maternity hospitals in these countries are like massively under resourced. There's not enough staff working in them, and the skill levels aren't as high of the staff as in like in developed countries. So the doctor, the obstetrician, like when things, if there's any kind of things not going right, they might just jump to perform a cesarean section. Whereas like in a more developed country, just like better staffing, like higher trained physicians and stuff, would see that like there wasn't as big of a need for a cesarean section. So that's, I think, definitely a big increase. Then there's also kind of the issue of just women themselves wanting cesarean sections over natural birth. And so in some countries, like there's kind of a status element to it. I think Brazil is one of these countries where um it's kind of seen as a high status thing to have a cesarean section, probably because it costs more, going to a private hospital as opposed to a public one. Um, the celebrities in some of these countries might very often have cesarean sections, because they're afraid of like stretch marks or whatever. So that can kind of influence like women's perceptions as well. Also just the pain of childbirth. cesarean section, particularly the elective cesarean section, so cesarean before labor, that just removes the pain of childbirth completely. Um, then like possible like negative impacts on like sexual relationships, like the woman might fear that her body might change too dramatically after, like a natural birth, so she might prefer a cesarean for that reason. Also just like, like past negative experience with natural birth a woman might prefer a cesarean the next time. Also like uh like pelvic floor damage, that's another reason. Possible pelvic floor damage, that's like another reason that's unrelated to the increase in maternal overweight and obesity, um that is a factor, driving the increase in cesarean sections. So there are a number of both long-term and short-term risks of cesarean section to both the mother and the baby. So some of the short-term kind of negatives for the mother are things like, the obvious ones like scarring, pain, bleeding, but also like possible uterine rupture. And despite the use of antibiotics, there is also an increased risk of infection, as there always is with any kind of surgery. There's also a higher risk of blood clots um, after a cesarean section compared to a natural birth. Now, blood clots can obviously, if they get into the lungs or the heart or the brain, they can be incredibly dangerous, lethal even. Um, Now, in terms of long-term side effects, for the mother, long-term side effects of cesarean section, the mother is at a higher risk of miscarriage. Afterwards, there also can be issues with uh, an embryo just being implanted in the lining of the uterus after a cesarean section. If the woman goes on to get pregnant again, there can be complications in labor with future pregnancies. And then also, basically, a woman is that's had one cesarean section, if she gets pregnant again, is more likely to have another cesarean section. She's at increased risk of cesarean section for subsequent pregnancies. Now, for the child, there are again both short term and long term risks. So some of the short term ones are, it's quite uncommon, but it can happen sometimes, where the child actually gets a small cut during the surgery. I think it only happens in like maybe 2 or 3% of cases, but it can happen. Um, Another issue that's extremely common for children born via cesarean section is that they have breathing difficulties. Now, this in developed countries can be solved quite easily by just bringing the child to the kind of neonatal unit and then just putting them in an incubator. Now, for the more long-term side effects for the kids, that's like asthma, allergies, even autism is more common among children that were born via cesarean section. And then, of course, uh, childhood obesity. So, why is it then that children born via cesarean section have a much higher risk of obesity in childhood and then into adulthood as well? So, the reason for that is when a child is born naturally, it goes headfirst through the birth canal. It spends a few hours in the birth canal. Now, in the birth canal, there's like lots and lots of different bacteria, like and that bacteria rapidly colonizes the baby. Now, the baby prior to going into the birth canal doesn't have very much bacteria on it at all. And this bacteria, colonizes like every square inch of its body. It even goes into its mouth, and right down into its digestional tract. Um, Now, when that child is pushed out into the real world, it's exposed to some fecal matter from its mother. That in turn has bacteria which also colonizes the baby, and then that's beneficial bacteria that helps the baby. Then the baby is also breastfed. Well, hopefully it's breastfed. So the first milk that comes out of the breast is colostrum. So colostrum is a very specific type of breast milk that contains, a huge diversity of beneficial bacteria for the baby. Then, after a few days, colostrum just turns into regular breast milk, and that in turn also um, contains lots of helpful bacteria for the baby. Now, what this bacteria does is it helps develop what's known as the microbiome. So the microbiome is just the sum total of all bacteria, fungi, and viruses that live in or are on top of your body. Um, Now about 70% of your microbiome is contained in your gastrointestinal tract. Um, and that is involved in those bacteria, the gut microbiome, is involved in like digestion, it's involved in synthesizing vitamins, it's involved in fat storage, um, it's involved in like the immune system, supporting the immune system. So when you compare the bacteria that's living on a baby that was delivered via cesarean section and a baby that was delivered naturally, one thing that is noticed is that the bacteria is different. Um, so babies that were delivered via cesarean section, they didn't go through the birth canal, so they weren't exposed to all that beneficial bacteria in the birth canal. Now, also, babies that are born via cesarean section are also less likely to be breastfed. So again, they don't get all that beneficial bacteria that's in the mother's breast milk. And if they are breastfed, they tend to be breastfed for less, like a shorter duration of time. Now, there have also been studies done on babies that were born via an elective cesarean, so that's just when a cesarean before labor even begins, an emergency cesarean, so cesarean during labor that has to be performed, and then natural birth. And what was found was that babies born via elective cesarean had higher rates of obesity than the ones born via emergency cesarean, and then the ones born via emergency cesarean had higher rates of childhood obesity than the ones that were born naturally. Now, the reasons for this is because the ones that were born via emergency cesarean had somewhat gone into the birth canal and somewhat been exposed to the beneficial bacteria in the birth canal, whereas the ones that were born via elective cesarean, they weren't exposed to the gut bacteria in or sorry, to the bacteria in the birth canal at all. Um, so one thing that is noticed among obese adults, and there's been lots and lots of studies done on this, is that obese adults have a lower diversity of gut bacteria than lean adults, and there seems to be a relationship between having a low diversity of gut bacteria and being overweight. Now, this does make somewhat sense given that the gut bacteria is heavily involved in digestion, involved in fat storage, but it also makes sense why um, children born via cesarean are more likely to have allergies, are more likely to have asthma, because gut bacteria is also involved in supporting the immune system. Now, also, like, children born via cesarean are more likely to have autism as well. Like, autistic children are more likely to have born via cesarean section. Now, the reason for this is, I think, obviously this is going to be controversial, but like, the reason is for because the gut bacteria that the autistic children are going to have is going to be different to the non-autistic children. But the gut microbiome and just the microbiome in general keeps developing up until about 3 years of age. Once the child gets to 3 years of age, the gut microbiome is going to be roughly the same as an adult's microbiome. Um, Now, between 0 and 3 years of age, the child's brain is developing rapidly. Now, if some of those bacteria are missing, um, or they just didn't get them because they didn't go through the birth canal, or they were exposed to antibiotics, which killed a lot of the beneficial bacteria, um, they mightn't have that helpful bacteria that's used in brain development. So their brain might develop in an atypical manner, and the atypical manner could end up being like autistic sort of behavior, like reduced social interaction, like repetitive behaviors, and that sort of thing. Um, so yeah, I hope um this video has been informative. I hope that you've learned something. Just let me know what you think, and I'll see you in the next one.